Minimally invasive spinal surgery is really a subfield of neurosurgery that has developed in the last few years. And it's really a very separate entity of neurosurgery itself. It is really the marriage of technology with surgical technique, and it's an evolving process. Really the goal of the minimally invasive procedures is to minimize the time spent in recovering from surgery itself, and it requires the surgeon to be quite adroit at developing the new surgical techniques. It allows theoretically a panoptic view to the spine itself, but the only way that that can be achieved is, as I mentioned before, the marriage of these technologies, which include microscopic techniques, endoscopic techniques, stereotactic, ultrasonic, and laser. And these are all very big technologies. They're very expensive in and of themselves. They require a lot of investment on the part of both the medical system itself as well as the surgeon to combine both the technical aspect of the surgical skills with the technological aspect that is being brought forth. So stereotaxis, for instance, is the ability to navigate in and around the spine in 3 dimensions without having the entire spine open. It can be done in some ways. The way to understand it better perhaps is how satellites locate all of us in space through our iPhones at any place on the globe, so we can localize any point inside the patient's spine, or frankly intracranially as well. So these techniques can be used to great effect. The surgeon is then quite dependent not just on knowing and mastering these new techniques, but also on a very large support staff. So to be able to do these procedures and do them very effectively, the surgeon must coordinate very carefully with the supporting staff of the hospital, the operating room, the intensive care unit, so that everybody is up to speed. It requires a lot of education, requires a very high level of educational involvement by the staff and by the surgeon itself. The bottom line is that the future of a lot of neurosurgery, including spinal procedures, is going to be minimally invasive. And I do believe that as my practice evolves over the next several decades, minimally invasive procedures will not only dominate, but perhaps be the majority of what we will be doing to the benefit of all our patients.